Okay, welcome to Chapter 4, which is Important Professional Issues in Addictions Counseling. This is about 16 slides, so it should be a rather short lecture, about 15 minutes. We're going to discuss in this lecture professional issues, ethical, legal, competent treatment of substance abuse clients. Keep in mind that, like I said in the very first class, that since we have an entire class, PSYT 1371 on ethics, we're not going to touch as much on that in this class other than this lecture and some quick discussion and group activities in class. The thing that's important to learn about the profession is the difference between a professional affiliation, ethical codes, and laws that are applicable, state and federal. Counselor competence is an important part of ethical practice. It's the comorbidity of psychiatric issues and substance abuse, or what we call co-occurring disorders. Someone, if they're going to work in that field, needs to have training in it. If you're going to work with adolescents, you need to have training in that area. So counselor competence has to do with the areas of specialization that you're trained in. Polysubstance abuse and dependence, which is multiple substance abuse. In each of these areas, you should have a good working knowledge, theory, treatment, and recovery models, which is the trans-theoretical theory of change. And we're going to work on that. Prochaska and DiClemente are the founders of that. We're going to work on that, and we'll see a video from DiClemente later in the semester. You must understand the therapeutic relationship and be able to adequately communicate that to your client, as well as be aware of boundary violation and boundary crossing issues, as well as multiculturalism. Okay, so counselor competence is considered education and also continuing education. You need to know what is enough education or when to refer, to know when your competency level is not enough to deal with a certain client issue. This can cause issues if you don't refer, and you probably should have. Also, there's something called counselors in recovery. If you have a professional relationship with someone, you should never counsel them. That would be called a dual relationship. What we can look at is with competence, and this is something that I'll say in class, and you'll hear me talk about this later in the semester, is that there are two types of clients' responses that you're going to see when you discuss your background, and it's called self-disclosure. You're going to have clients who say that I really want a counselor who's been there, who's been through what I've been through. And then you're going to have the clients who say, I want a counselor that's never tried drugs because they were strong enough to stay off of them. Either one doesn't matter. Your approach has to be be empathetic, to see the client's whereabouts in the client's direction, and to be able to have empathy for where the client is, whether you've been there or not, or whether you've experienced that type of addiction or not. Self-care, we call mental health days, or days, taking days off, making sure that you are in good shape to deal with clients' needs. Research-based practice, which is where you're going to look at continuing to build and better your process and your practice through experiences with clients and other research. And then, of course, continuing education is going to be the long-term process of updating yourself, being a part of different professional agencies, professional organizations, having a subscription to Recovery Today, the Addiction Professional, anything you can do to help yourself to be a better professional. Credentialing is the licensure practice. It's required for practice in many states. In the state of Texas, the entry-level clinician is considered to be, those working with substance abuse clients are considered to be LCDCs, licensed chemical dependency counselors. The next level up from that, it requires a master's degree, and that's going to be your licensed professional counselor, or your licensed marriage and family therapist, or your licensed master social worker. There are other certifications you can get. You can be a substance abuse professional, a master addiction professional. There's a lot of other certifications and accreditation that you can get. You can be an accredited domestic violence counselor. You can be a certified anger therapist. You can be a certified prevention specialist. You can be a certified criminal justice professional. You can be accredited to teach parenting. There's a lot of specializations that you can do within that realm of addictions counseling. Your license is going to be specific to, and you're going to follow the guidelines of it for practicing under it, but there are other areas that you can work in. There is no national standard. Some states you have to have a master's degree as well to be an addictions counselor. In other states you don't even have to have an associate. So there is no national standard. Many agencies, perhaps there will be emerging, and you'll see social work, professional counseling, and chemical dependency come together. The goal of credentialing is three common goals: to define core tasks, define core skills and knowledge, and assess competency of counselors. There are widely differing interpretations and requirements. We're going to look at those further later on in this semester for the state of Texas, and I already gave you a little synopsis of that in lecture number 2. The varying minimum requirements is 1.5 to 3 years of experience, 0 to 810 hours of training, 0 to 1,000 hours of practicum, 0 to 300 hours training and counseling, and 0 to 540 hours in alcohol and drugs. Like I said, there's possibility of some states having to be a mastered level clinician. In other words, you can't be an LCDC in some states without a master's degree. In most cases, the person is going to take a exam which is administered by the ICRC, which is the International Reciprocity International Counseling Reciprocity Consortium. In the state of Texas, you're going to do your 270 education hours with the 300-hour practicum, which gets you your counselor intern. During your counselor intern, you'll complete 4,000 hours of supervised work experience. While you're completing that work experience, you must finish or already have an associate's degree, complete and pass the written exam, complete the 4,000 hours, and then after 2 years' time, you'll be granted the LCDC. The core task and skills, which is also known as knowledge, KSAs, knowledge, skills, and applications, and these are the areas which is assessment, treatment planning, orientation, consultation, confidentiality, counseling, crisis intervention, discharge planning, follow-up activities, referral, client advocacy, and personal and professional growth. In Texas, these are known as the 12 core functions of an addictions counselor, and we're going to look at that and break it down to the 12 cores as it relates to your functioning of licensure in Texas. The state law for Texas, if you go and you read the actual wording of it, it says that anyone who treats addictions must have, or that works in addictions counseling must have a license to do so. The state is the legislature that determines the requirements, exam, or supervised practice. Now what I'll say about that is recently in Texas they did away with the oral exam, and now it's a case presentation oral method within the written exam. So when I went through the ranks, there was a written exam and an oral examination. And the oral examination, just so you know, was basically you verbally talking to a panel of LCDCs. You would talk through the 12 core functions and take a client from screening to discharge and talk about all of the things you did with that client. It was rather, tedious is a good way to describe the process for the oral exam. I'm glad that they've done away with it. Accreditation applies to education programs within colleges intended to ensure the quality and standards of education. Professional organizations specify standards and criteria such as student to faculty ratio, critical content, and experiential components. We are a accredited program for DSHS for LCDC program. We are set up for, specifically our program is set up to meet the curriculum guidelines of the state, so that when you go through this, you're ready to apply for licensure and also take the examination. Treatment issues in managed care, lower short-term costs, long-term consequences. Managed care there's an article I read recently that said that there's a de facto call for master's degrees in order to bill insurance. So basically, if insurance is paying for treatment and it's within a facility that's a licensed facility, that there's a wave of calling for, or the managed care insurance companies are saying that they will only pay for treatment done by someone with a master's degree. So that is kind of troubling for those of you who may be going into private practice. You would definitely want to keep up to date with those different occurrences. Confidentiality concerns with managed care gatekeeper refers for treatment. Session limits, group therapy popular, little focus on prevention, and limited lifetime coverage. In other words, an insurance company is only going to pay for a certain amount of treatment, and there's an ethical debate there, because what if what they pay for is not enough for the client to get sober, and what if their limits are run out before they receive their desired sobriety level. Research issues, there's a push for empirical support, concerns about research process and evidence. This is called evidence-based practices, and you're going to hear a lot about this in future in the field in the future. Basically, your payors, your grants, your contracts, your managed care insurance companies are going to put limitations on what they will pay for, and oftentimes they're going to say that they will only pay for something if it's evidence-based. Another ethical thing we'll have to talk about in class. Recent research shows meta-analysis found promising results in several prevention programs, mixed results on treatment outcomes, and then Project Match, which matches a client with a appropriate facility for the optimum outcome or the optimum treatment outcome. Problems with outcome research is methodological. I'm having a hard time saying words today. The methodological issues restrict the interpretation and generalization of results. Different treatment settings have different outcomes, restricted baseline measures, different outcome measures, and there's a philosophical versus empirical approaches. The philosophical approach would be treating a client where they are based on whether research shows that something is valid or not, going by a clinician, which is what we go to college and learn for, going by a clinician's recommendation instead of relying on research or empirical approaches, is where the methodological issues come in, because the results are not always founded, and it's virtually impossible to look at every treatment possibility in order to come out with the appropriate outcome for that episode. Suggestions for future research would be outcome research, uses qualitative and quantitative research, use common classification and only include programs with drug use measures, conduct meta-analysis with large set of programs, take into account client variables, and client success criteria must be standardized. In other words, what are we looking for someone to get out of a program? Can we measure that? Can we make sure that it's appropriate and that all programs are using the same type of approach when we're going to measure them? In other words, only use drug programs and only research drug programs, and not researching alcohol programs or other type of co-occurring disorder programs. Here's some useful sites for you to go into and look at. ICRC, you've heard me talk about that. NADAC, you've heard me talk about that, as well as NIAA, which is now, I believe, almost completely finished merging. In NIDA and NIAA are supposedly merging, and so when I get that new site, I will definitely